When looking at adding employee benefits, most people want to start with health insurance. In survey after survey, it's the most requested benefit by employees and the most appreciated of all the benefits. But most employers don't know what the requirements are and how much it costs. In this short video, we'll try to help you answer those questions. First, let's talk about what's required. If you are a large employer, loosely defined as 50 or more employees, you're required to offer coverage to all of your full-time employees. Full-time is defined as 30 or more hours per week. If you do not offer coverage, you're subject to an IRS penalty that's indexed each year. It currently sits at $23.20 per person in 2018. Small employers, those with less than 50 employees, are not required to offer coverage, but may choose to do so. If you're interested in offering coverage, generally speaking, you really have two types of group coverage you can offer. One we're going to call standard coverage, and the other we call essential coverage. Both types of coverage have the same two rules that you'd need to follow. First rule, that all of your eligible employees come on the plan unless they are covered under other insurance, like spouse, or covered under their parents' plan, or ex-military. Two, that you, the employer, pay at least half of the single monthly rate for your staff. What's an eligible employee? Small employers can pick eligibility hours per week up to a maximum of 40. Large employers have to use the Affordable Care Act definition, which is 30 hours or more per week. You cannot define eligible employees other than hours per week and a 60-day waiting period. Second, what's the difference in benefits and costs between the two plans? Standard plans cover all the expenses you would typically expect health insurance to cover. Hospital bills, emergency room, surgery, doctor's visits, and preventive care are all part of that list. And they can cost generally from $250 to up to $700 per person per month or more, based on the age and sex of your staff. These plans typically have a high deductible to satisfy before insurance even kicks in, but do utilize co-payments that can range from $25 to $50 for doctor's visits and prescriptions. Essential coverage plans cover some of the same expenses the other plans do and come at a decreased cost. These plans cover preventive care at 100% and can provide reimbursement for doctors for office visits, telemedicine, prescription discounts, lab and x-ray, and even dental expenses. The costs on these plans range from $35 to $90 per person per month. The advantage of these plans is the lower cost and that the benefits provided are for the most typical expenses incurred without having to meet a high deductible. The other big benefit to the essential plans is that they'll satisfy the $2,320 penalty that large employers are subject to. And it also gets the employees out of the individual penalty. Thank you for taking time to watch our video. We hope it helps you to understand your options and the costs associated with health insurance. If you'd like to find out more about this subject or have any questions, please don't hesitate to contact us in the information provided in this video.